looking at all the information we have about cannabis and brain health already, and then from that, build another evidence-based and conduct research off of that. Right now, it's so difficult to get funding in the UK for empirical research related to cannabis. And I think it's really too bad, because the UK does such amazing research, especially when it comes to brain health and dementia. It's why I came from Canada. And so to not include anything to do with cannabis because of the stigma surrounding it and the misinformation, it's really too bad. And it doesn't have to be that way. And hopefully in 5 years, you and I will be like, remember when we talked about that? That was mad.
Hi, everyone, and welcome back to Harmonia Podcast. We are joined here today by the beautiful Laura Booi. Hi, Laura.
Hello.
Thank you so much for joining us, Laura. So Laura is a brain health researcher, and she does a lot of work around dementia and has recently started looking into how cannabis can play a role into this. So I'm super excited because my knowledge of dementia is limited to psychology. After that, I have no idea. So I'm super excited to have her on here today. But before we get started, let me just hand over to Laura so that she can do a more formal introduction.
Ooh. Thank you. It's always a bit nerve-wracking doing a formal introduction. So my name is Laura Booi. I have a PhD in gerontology, and I focused for the last 15 years on brain health. How can populations reduce their risk of dementia? And then also post-diagnostic support in dementia. So if you do receive a dementia diagnosis or a loved one does, what can we do to make sure their quality of life is as good as possible? I can talk a little bit about dementia and why it's important if you like.
Yes, please. The floor is all yours now.
Awesome. Okay, get comfortable. So basically, I became obsessed with dementia when I was a teenager and moved in with my grandpa. He didn't have dementia at that time, but I saw what it was like to live with somebody who was 80 when I was 18. So he's no longer with us, rest in peace. But it really sparked my drive to say, what can we do to basically make the world better for our aging population, for our older adults? So, and then when I heard out about dementia, I was like, what is this? And then just with the sheer numbers globally, it's such an equity issue. So right now there's 1 million people with dementia in the UK alone. There's 55 million people with dementia in the world. In 15 years, that number will double. By 2050, that number will triple approximately. So there's a huge amount of people that will be living with dementia. Also, I look at it, it's also a women's issue, right? So dementia is an umbrella term. Alzheimer's disease is the most common form of dementia. A lot of people listening will already know that. So Alzheimer's disease, you're twice as likely to get it if you are a woman. If you're a man, you're more likely to get something like Lewy body dementia. The prevalence is higher there. But also if you're a woman, you're 2 to 3 times more likely to care for a loved one with dementia. So all of these things, surround the fact that dementia is a huge issue for populations that are often marginalized by both the healthcare sector and healthcare research. I think that's for now. And okay, I'll just say one more thing. I'll also say that a large part of my work speaking to the public is reassuring people that dementia is not a normal part of aging. People will often think, if I'm going to get older, I'm going to get dementia. They just go hand in hand. That's absolutely not the case. Dementia is not a normal part of aging. And there's many lifestyle things we can do and many public health measures that could be put in place to reduce our risk of dementia, both individually and also at a population level. So that's kind of where my research lies. And then because I come from Vancouver Island. I live in the UK now. I'm a senior research fellow at Leeds Beckett University in their Centre for Dementia Research, and I'm a senior Atlantic fellow with the Global Brain Health Institute at Trinity College Dublin and the University of California in San Francisco. So those are my professional credentials. But I've always been an advocate for cannabis, so cannabis use, cannabis and health. I care a lot about this area, and I was in Canada when it became legalized both medically and recreationally. Then I moved to Ireland, and then I moved to the UK. And so I've just been watching cannabis policies around me and how they intersect with both population health as well as research. And so that's why Britta invited me onto this podcast to have a discussion about this.
Wow. That was an introduction. Okay. So much for I hate introductions.
Sorry, buddy. I'm honestly like dementia is something I care so much about, and yeah, just going to ramble.
No, this perfect. This is exactly what we love. One of the things. Okay, you said so many things, so I was over here taking lots of notes, and I'm trying not to be all ADHD all over the place. So I'm gonna take a deep breath, and I'm gonna just take it one question at a time. Right. So, the figures are scary. The figures are very very scary. I did not read 55 million people, and it's due to escalate. Like yeah, this is a very very serious concern, right? And one of the things that I find even more disturbing around this is that whenever there is a sort of public health issue, like let's take for example obesity, right? The government was very very proactive about this and has had lots of weight loss campaigns. There's been so many things being done about this, right? I don't see anything being done about dementia, especially if there's 55 million people. I get it. Yes, there's about what? I don't even know how many billions of people there is anymore. 8 billion or something now. I don't know, man. It's weird. But the point is, I get that on the grand scheme of things, yeah, 55 million might not seem like such a large number, but that is still that's a lot of people. That's like, that's nearly the population of the UK.
It's more than the population of Canada. So there's more people in the world living with dementia right now than there are actual Canadians. To put it into perspective, so it's absolutely huge, and it gets even worse because the predictions show that upwards of 60% of the new cases that are coming forward are going to be individuals from low and middle income countries. So it is such an equity issue because the people that are most marginalized from healthcare resources and basically public health measures are the ones that are at greater risk for dementia. And I don't think that's also understood. And this is all based on socioeconomic factors that revolve around the populations, not necessarily. And of course, there's individual measures as well, but there's a lot of different factors involved.
Yeah, no, and okay, so going back to some of the other questions that I had, then, yeah, I was just wondering then because you said something that was actually really, really um, heartwarming. No, it's really heartwarming because a lot of people don't talk like that anymore, right? And that is that dementia is not a normal part of aging. And when you said that, though, that literally just made my brain go ding, 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 because I don't know why, but like everybody else, I'm assuming we're just here thinking, oh yeah, you get older and then you get dementia, and that's it. And it's so sad that we've normalized this. So I'm so glad that you said that because I didn't even realize that I've normalized it until you said that, and I went, oh my god, that's a good point.
100%. We could theoretically create an existence where dementia is a thing of the past in the human population. Big sky thinking and all that, right? But I mean, it doesn't have to be what it is. And right now, it is people are more afraid of getting dementia and going into a nursing home than they are of death. So it is the most feared thing out there as far as diseases and human conditions is concerned. And 100% as far as public health measures taking place to really broadcast, there's things we can do to reduce our risk of dementia. You do not have to be afraid of it. That hasn't taken place. And I believe one of the reasons that that's true is because if a government right now was to put those measures in place, they wouldn't see the positive fallout of those ramifications for decades. So it's the same reason sometimes getting grant money to do research in this area is pretty difficult. It can be difficult is because the actual outcomes shown, like if I put in an intervention and I'm like, Laura and Berta, are you guys going to get dementia? Putting an intervention in now, we won't know for another, 70 years.
Yeah, no, I get what you mean. And I guess this is the issue when it comes to things like this is that there is that, it's the whole argument of instant versus delayed gratification. And a lot of the times, when you're a government and you're looking at public health issues, you're looking at the stuff that you can resolve now, not the stuff that you can resolve in the future. Although we all know investing in the stuff now is what's actually going to improve things further down the line. But yeah, the world is complicated place to live in. But there's just one. Okay, so one of the things that before we move on to the cannabis side of things, though, it's just one of the things that I think for a lot of people that wouldn't necessarily be aware of dementia. What are sort of like early signs to look out for? And no, I'll ask that question first. Yeah.
No, 100%. And this is a really good question. I mean, there's so many, like I said, this is the most feared condition. So people always want to know. And I feel like every time I do a public lecture, there's always somebody in the audience who will say, sometimes I walk into a room and I forget what I'm doing, or I lose my keys. And honestly, those are completely normal signs of anything. Like, come on, like our brain is an organ like any other organ in the body. If we have anxiety, high stress, it's going to be more difficult for memory, as many of us will attest to with brain fog and everything else. So things to look out for. And I really want to bracket this by saying, please do not fear dementia. I know we've all had dementia in the family. Most of us have, and it's really terrifying and heartbreaking. But being fearful of it just propagates more things that are not necessarily positive that will help you in the future. One of my closest friends and colleagues, she has an entire program of research in Chicago looking at fear of dementia and how that affects our lifestyle. So really the benefit would be, I know it's very interesting, but let's talk about my research first. But it's very interesting. But yeah, just to say, like, please don't ever be fearful of dementia. There's so many different resources you can link out to if you are for a second worried about someone. But things like if all of a sudden, if you have a fork and you're eating and all of a sudden you forget how to use an instrument, something like that, or you have a mouse at your computer and you're like, oh, what am I doing with this? Something that your brain would know immediately what it is and how to use it. And if all of a sudden you're like, I don't know how to do this, then that would be something that wouldn't necessarily be normal. But I mean, buddy, there's so many different types of dementia, like Lewy body dementia that I mentioned earlier. The main symptom isn't memory loss. Like in Alzheimer's disease, it would be memory loss. With Lewy body dementia, the main symptom would be extreme issues with your sleep and then visual and auditory hallucinations. So, and Robin Williams, the famous comedian, he died by suicide because he had Lewy body dementia. Really interesting story, interesting documentary around that as well. But yeah, I can't really say there's any specific symptoms for all the dementias because there's hundreds of different types of dementia.
No. That's thank you very much, and I think that you just gave us a really good overview, especially in terms of explaining it. Sorry, I loved how you explained it, which is something that you should know how to do, and then all of a sudden you don't know how to do. That's more of a cause for concern than somebody walking into a room 10 times and forgetting the reason why they went in there. For the record, I do both. The processing though, but
sometimes it's a bit extreme, but you know what I mean. Like, don't be fearful.
I know. No, I get you. But yeah, so that, and I think that's the key thing here, in terms of just understanding the differences, because I do know, like, and I think we all say it, especially as you start to get older. And as we start to get older, we start to get, I suppose, more stressed, and you start to get more symptomatic. You start to worry because you start thinking to yourself, oh my God, I'm starting to forget things. I'm starting to not remember I'm starting to have blanks in my memory, like actual gaps in my memory. And you start to freak out and you're like, oh my God, is this early onset dementia? Like, what is going on here? And, it's nice knowing then that when these incidences happen, that's just us being stressed. Like, the reality of the situation is, if I still know how to use a fork, then the likelihood of there being onset dementia is reduced significantly.
Oh, and also I just want to add, for everyone who's listening to this, your risk of dementia before the age of 65 is really low. After 65, it's pretty much 1 in 4 that you'll, at some state in the 70s, 80s, you could potentially get dementia. But with young onset dementia, so let's say of someone in their 40s or even 50s, there's more of a genetic component to that than there would be for Alzheimer's disease. So you would see family members already having that in your bloodline. So it wouldn't come out of nowhere. That's really, really rare. So again, don't be afraid of that either.
So again, I'm really glad we're having these conversations because let's be honest, we all do feel like that sometimes. And I've spoken, I work in mental health. Do you know how many people I speak to because people don't realize anxiety, depression, stress, again, it messes you up cognitively. Let's just leave it like that. And one of these symptoms is sheer memory loss, and people they underestimate this memory loss until they're experiencing it, and then you're trying to explain to them you don't have dementia. Okay, it's your anxiety. They're like, no, anxiety can't make me forget a whole day. I'm like, yeah, I can. If you like, yeah, I can. So it's really nice that you're actually mentioning this because it will resonate with a lot of people, and it will help a lot of people to understand that actually maybe we need to start revisiting what is really going on for you and start looking at ways that you can improve that. Which brings me to my second question, actually, which is what are some of the lifestyle changes that people can start adapting now so that they can prevent dementia in the future?
Oh my God, this is my favorite topic. Other than cannabis, this is my favorite topic. And you said something there that I wanted to come back to. One more thing about risk of dementia. That's just for women especially. I know so many cases of women going through menopause and their doctors being like, their physicians, being like, maybe this is cognitive impairment, maybe this is mild cognitive impairment. So please and then later down the line, after so many tests, they'll say, no, it's menopause. So I think especially for women as we age, to be really cognizant of what is happening because of our hormones, what is happening because of some sort of pathology in the brain, and just to be, again, not fearful, but also don't immediately run to, I have Alzheimer's disease. That's like, that doesn't need to be the case. So for risk factors, there was just a publication out a few months ago that it's called the Lancet Dementia Commission. You can Google it. If you can't access it, maybe I shouldn't have said that. But anyway.
So sorry for interrupting. If you send me the link I can add it to the description section.
That sounds great. So the Dementia Lancet Commission 2024, it just came out, and it's this massive study with all these researchers combining a huge amount of data to look at what are all these lifestyle factors and how do we link them to risk of dementia. And basically what these people did is they have organized 12 different lifestyle factors that account for 45% of dementia risk. So if we got rid of all these lifestyle factors, we would cut the global prevalence of dementia by 45%. I know, buddy. I know, right? So that's also why people are like, oh, there's nothing I can do. I'm going to get dementia. My mom has it. It's like, no. You have almost half of your risk is chosen by lifestyle factors for most forms of dementia.
Okay. And is it cheeky of me to ask? Yeah.
No, I'm not telling you that. That's a spoiler. No, I'm just kidding. Honestly, some of them are so obvious, and you can Google, anybody listening to this can Google risk factors for dementia, and 12 things will come up. As research progresses, we'll have more things. So the common things, the obvious things are like, oh, that went out, whatever. The obvious things are like, drinking less alcohol, being socially active, so being with other people, not having brain injury or head injury. But then there's other things that have come up that are really interesting. So things like air pollution. If you live in a place where there's greater air pollution, your risk of dementia will be greater. And again, some of these things we can't modify, because if you are living in a low income situation, you live where you live. You don't have the mobility to move around, right? Other things would be that are really interesting is like hearing loss. So if we have any people in our family who, like my grandpa only had one ear, but like he needed a hearing aid for his other ear earlier on. If you have any sort of hearing loss, that puts you at greater risk of dementia. But if you get a hearing aid, that negates that risk. So that's why it's so important that people, especially people, older adults, get their hearing checked, especially people in midlife too, because you can really reduce your risk there. And the same thing with eyesight. If you are potentially having any issues with eyesight, go get tested and put in, glasses or whatever you need to get that figured out. Interesting, huh? Is it interesting, or is it just me who's like, this is so...
No. First, Very, very interesting. Hearing loss, a lot of stuff just made sense to me right now because I used to wonder why that was always in certain like medical questionnaires and stuff like that, relating to brain health. So I'm like, oh, okay, that loads of stuff just fell into place there. But air pollution, very interesting. It makes sense because, poison, you're putting that into your brain. So yeah, I get that, but it's not something that you would have actually considered. So that's actually really interesting. Socially active, I understand, because if you're interacting with people regularly, then that is really good for your brain, full stop. Eyesight, yeah, actually that one I'm surprised by.
Because it's all like if your brain is the organ, right? So if your eyes are not working the way they should be working, what else is happening to your brain to counter, not to, you know what I mean? What's the word for it? Not counteract, but
No, I get what you mean. It has to work harder then as a result. Like, so you're putting so much more pressure onto it. Like, okay, yeah, that makes sense. Okay, yeah, these are very interesting facts, guys. I will try and put a link down that you mentioned there because I think it would actually be very interesting for people to get the 12 facts. And okay, yeah, let's move on to then cannabis and that how that contributes to brain health.
For sure. I mean, I do want to say one more risk factor that isn't in the 12, but I believe, and my research team believes, that coming up in the next few years, this will be in the 12. It's intimate partner violence for women. So I guess if there is a trigger warning, we are talking about intimate partner violence. But there's a massive, people will often think about footballers, rugby players, oh, they're more at risk of dementia. Actually, women experiencing intimate partner violence they can be way more at risk for dementia earlier in life. A lot of new research is coming out in this area. So I just want to put a pin in it and say, if you've experienced intimate partner violence in the past, just be more aware of your brain health going forward. If anybody wants to reach out to discuss or anything like that, I can link you in with experts, but it is something that's especially important for women. Yeah, that's all.
Oh, well, that is absolutely amazing. I've never really heard of that. Okay, sorry, I've got questions. You can't just say that and then move on.
I know. It's so important. And people I remember being at a conference when the people showed the intimate partner violence data and all the professors were like, that can't be right. And then all the women in the audience were like, yeah, that is how often women experience intimate partner violence. And this is the data that shows the long-term risk for dementia later on in life.
So I wonder if it's related to repression when people are trying to suppress horrible memories, and if that contributes something to it, because I can definitely see that playing a role.
100%. I mean, I like fully, I'm not the expert in this area. I know people that are, and I'm involved in some of the research there. But yeah, potentially repression, potentially also social isolation that comes with experiencing some of these things, the physical aspects of it. So whatever could be happening to hurt the throat or head area, anything like that, heightened anxiety, we can think of all these risk factors that all are like, this will make an individual closer to risk.
Yeah. Okay. Thank you very much. Okay. Let's move on. Where were we? Oh, yes. Cannabis's contribution towards, I suppose, brain health.
So there was and I was thinking about this while I was walking, to come and do this. There was a brilliant professor in Montreal who published a paper 2 years ago, Patricia Conrad, and it was about basically telling off brain health researchers in our longitudinal studies, we need to be incorporating cannabis metrics. So what that means is, let's say we have one of the studies I'm involved in follows people from 40 to 60 years old up until till the end of life. So this study's been going on for 10 years. That study doesn't include specific cannabis metrics for it. And it's okay. I mean, it's in the UK. The chances that somebody's going to be using medical cannabis in that group wouldn't be necessarily that high. But in a place like Canada, where recreational and medical cannabis is so prevalent, at one point in Vancouver, there was more dispensaries than there was Starbucks. So in a place, you know what I mean? Like in a place where it's so prevalent, why are we not capturing this data and then relating it out to outcomes about brain health and about health in general? So it's a really lost opportunity in the scientific world. And lots of other researchers will say the exact same thing. everything, basically because of stigma and misinformation that has to do with cannabis, which for you, I'm preaching to the choir.
Yeah, and it's okay. So for our audience who don't know what a cannabis matrix is, would you please be able to explain that?
Oh, a cannabis matrix? Do you mean a longitudinal study? Because I don't. Okay, longitudinal study. So a longitudinal study would be, let's say you signed up to be a part of a research project. A longitudinal study would basically take a bunch of measurements of you. So that would be, they would do cognitive tests, they would do personality tests, they would do health inventories. They'd basically do an MOT of you. Perhaps if it's a brain health study, we'd also do an MRI, something like a brain scan to look at what actually is happening with your brain. And then follow those individuals. So every, let's say, 2 or 3 years, you'd go back to the university or back to the hospital and get all this information done again. So that over time, we have this longitudinal sample of what changes could be in your health. And the fact that individuals, or the fact that researchers don't ask about cannabis is a missed opportunity to look at the potential positive or negative effects of this substance in users.
And you know what? That is actually a really, really good point, because it is a huge missed opportunity there. And I feel like when it comes to just medical cannabis, full stop, it is a missed opportunity in a lot of areas. And a lot of the times I tend to find that the minute you even mention a prescription, like a medical cannabis prescription, you're already excluded from so much research opportunities, which makes no sense, because had you been on a alternative psychoactive substance, it wouldn't have even been an issue. And I just felt it's a missed opportunity. It's such a, like,
100%, especially when the cannabis world is, I shouldn't say it's crying out, but as a scientist, as a researcher, we need an evidence base to be able to inform policy about what decisions to implement to keep our populations healthy. If we don't have that evidence base, we're flying in the dark. So it really is one of these things of like, how does cannabis affect dementia? Could we please put in these metrics for this research? So maybe not in 2 years, maybe not, however many years, we'll be able to find some actual results. And then from that, hopefully make people's lives better.
And do you know what? That actually brings me to the sort of questions I always like to ask everyone. And that is, actually, I'm going to ask you three. Sorry. I know I usually ask the two, but I'm going to ask you three, because I would like your advice on what you feel the industry can contribute moving forwards in terms of brain health, dementia, because, as you're aware, the industry is slowly growing, but we are slowly growing. And as we're growing, we want to make sure that all of these categories that are generally excluded in, I suppose, general healthcare aren't excluded here, basically. We don't want to make the same mistakes. Am I making any sense?
So what the industry could do to link in more with brain health ventures, because really, we're all in this together, right? Researchers, cannabis business people, patients. I know that wasn't professional, but you know what I mean. So I honestly think there needs to be a greater merger with research being conducted and with industry. One of the things that I really want to do, and I haven't been able to do it yet. So if anybody's interested in working with me on this, I'd really love to do a systematic review, like a really strong paper looking at all the information we have about cannabis and brain health already. And then from that, build another evidence base and conduct research off of that. Right now, it's so difficult to get funding in the UK for empirical research related to cannabis. And I think it's really too bad, because the UK does such amazing research, especially when it comes to brain health and dementia. It's why I came from Canada. And so to not include anything to do with cannabis because of the stigma surrounding it and the misinformation, it's really too bad. And it doesn't have to be that way. And hopefully in 5 years, you and I will be like, remember when we talked about that? That was mad. Fingers crossed.
Fingers crossed, man. And the second part is actually a two-part question. So I suppose the first part of it is any advice that you would give to any cannabis naive patients who are at the moment living with dementia, or have a loved one living with dementia and are considering a prescription but are very, very nervous because of the stigma.
Oh, I mean, honestly, it's really tough. That's a really beautiful question because the stigma surrounding dementia is so strong as well, right? And so the stigma with cannabis use. So then you have a double whammy. So I would give, so two different things I would give response to. The first one would be link in with a cannabis group. So anybody who's also an advocate, you can just ask people questions, be with peers. The second thing is obviously talk to a clinician, talk to a professional. Don't necessarily just talk to somebody on the internet, and don't take my word for anything because I'm not a physician. I'm a researcher. I'm a decent person, but I'm not. I can't actually prescribe anything. Yeah, and I think just also with cannabis and brain health, or with cannabis and dementia, there's lots of good research looking at how cannabis can be used to both support the person living with dementia and to support the person caring for it. So one professor that comes to mind is Brian Caskey in the US, does amazing work. One of his articles is called Dementia and Caregiving, Lighting Up an Emerging Issue. So it's a pretty good article about looking at how cannabis can help people, dyads, in this situation with dementia. Yeah, I think that's it, buddy. And also, please don't be afraid of getting dementia. That would be the final thing. Is please, please, please don't let anything I've said spook anybody. There's lots of stuff we can do together.
Yeah, that's amazing. And just the dementia and the caregiving, that is absolutely fantastic. What was his name?
I'll send it. I'll give you a link, buddy. Yeah.
Yeah, that's amazing. And I think I'll share that link in this video as well for anybody that is interested. And then the last question was, again, it's relating to patients, but I suppose any patient that is considering sort of a cannabis prescription, as somebody who I suppose is outside of the industry, sort of looking in, what is sort of the feedback that you would give to patients?
To patients outside looking in, I mean, for a patient population, so we have two people who are worried about getting dementia and people who have dementia. I don't know what feedback I would give them, but I think the population, the professionals in the cannabis industry, I would just say it would be a benefit to everyone if there was more research and an evidence base surrounding the work that you do. It is so easy to say things that they don't have their foundation in facts or empirical evidence, and that does the entire cannabis world, all of us advocates and all of us who care, a massive disservice because it decredits us collectively. So really, I wish the cannabis business industry was more involved in the research side of things, and we could work together and kind of push the needle forward as far as cannabis professionalism and cannabis medically being used to help people.
And that is such a brilliant response. Like, I don't even know where to start. Like, okay. It's called Genius IQ, right? No, because you said something and you literally just hit the nail right in the head. And I'm having a trigger moment, right? So as part of my trigger, hey, I'm actually calm for a change, right? Goes to show, yeah, I'm doing well. But yeah, in terms of a trigger moment, yeah. So yes, it is sometimes disturbing actually when you sit down and you hear all these cases and people just saying stuff that's so unfounded, and you just think to yourself, when I ask people why you do that, they say to me, well, if we say the truth, right, then people are going to look down on us. No, actually, they're looking down on us now because they already know the truth, right? So the fact that you're not acknowledging the truth, then that just makes you look insane. And I have no idea why nobody understands this, and it actually drives me insane.
Oh, it is a frustrating thing to be like, you know what, the people would listen, individuals, groups, organizations, the government would potentially listen more and put more emphasis on the cannabis world to basically move things forward, to be more progressive if we had a stronger evidence base related to what cannabis does, specifically for any healthcare issue. But for me, because I care, older adults, dementia, brain health.
Yeah. And it would be, and also it makes, like you mentioned, newcomers feel a little bit more confident if there is something that they can look at. That, like if you think about it, similar to the BNF. I'm not sure if you're familiar. Actually, I should probably explain it to everyone. So the BNF is basically a diagnostic manual that GPs use when they are trying to determine what sort of medication to prescribe you. So if you went in there and you told them, right, I'm struggling with dementia. If you go in there and you tell them I'm struggling with dementia, then they would open up this book and they would look at the most suitable medication, and then you tell them what symptoms you're experiencing and stuff like that. Now, with cannabis, we don't have something like that. Now, I know that so many people have tried, and I think so many people are still really looking into that, and I am just seriously rooting for them, because that would give prescribers, cannabis naive prescribers, so much more confidence, because that I've noticed, like, somebody who has complex health needs, I go to my doctor and I'm like, oh, I'm experiencing this, and that. And they don't know what to do. And so their very first instinct is to go straight to the BNF and then be like, okay, why don't we trial you on this medication? And you should see how they calm down immediately once they sort of feel like, okay, this is the right decision that I'm making here, rather than feeling like, oh my God, and there's no guidance. Like, yeah, it just makes people so reluctant to want to engage. And sorry, that was such a long answer.
No, I love it. And there's also a ricochet effect for that, right? So because cannabis isn't in the NICE guidelines for dementia, it's very hard as a researcher to apply for funding to be able to do this work. So how can we build the evidence base? It's a little bit of a catch-22. But yeah, in the future, things are going to continue to get better. We're having this conversation. I think it just takes a while, but I do think it does the entire industry and the entire, everyone who cares about cannabis a disservice when individuals will say things that are not necessarily backed up by evidence. I mean, we can all say things colloquially. Cannabis did this for this person. It did this for this person. But to say it will cure this is like, oh, but buddy, I don't think you've done that research. So I think it is. I think we all have to work together and just be patient for where we are. Anyway, that was me ranting. Good grief.
No, it was beautiful, and it's exactly the perfect place to end it on, because I love to end it on a really strong note of people. Sorry, even me, I'm getting my brain fog. I love to end it on a really strong note because I like people to go and think after they've listened to it, and that is something really important to think about. So thank you so much, Laura, for joining us here today. Like, I've had such an engaging conversation here, and I've learned so much, and I really feel like our listeners would really enjoy this as well.
Thank you for having me. It's been, honestly, it's my two favorite topics come together. It's a gift.
No worries. For anybody that is interested in any of the work that Laura is doing, her social media will be in the description here. And I believe throughout the video, we mentioned about 3 different links. We will also include that in the description section of this video. And we look forward to seeing everyone again next week. Bye. Bye, Laura.
Bye.